Animals may carry bacteria, viruses and parasites. Some of these microorganisms can be transferred from animals to people and may cause diseases. Such diseases are called zoonoses. People can come into contact with pathogens from animals in different ways: via food, direct contact, or the environment. They can also be transmitted through little creatures, such as ticks and mosquitoes, that can transfer diseases from an animal to a human. These are known as vectors. Proper hygiene can often prevent people from catching a zoonosis. Make sure you prepare meat and other raw products in a suitable manner. Always wash your hands after direct contact with animals, and check yourself for ticks when you've been in the countryside.
Assalamualaikum and salam sejahtera. I am Nur Fakira binti Muhammad Adani from ED260. We'll talk about 2 dangers of zoonotic cat disease that we must watch out for. Although most feline infectious disease only affect cats, some of the disease can be transmitted from cats to people. Diseases that can be transmitted from animal to people are called zoonotic disease. While not comprehensive, today I will highlight the most common zoonotic diseases that may be carried by cat and simple precautions you can take to reduce your risk of contracting this disease. Research has shown that cats can provide emotional support, improve moods, and contribute to the overall morale of their owners. Cats are also credited with promoting socialization among older individuals and physically or mentally disabled people. The graph shows that nearly half of our patients with a typical cat scratch disease were still young, around 10 to 14 years old. Cat scratch disease is an infection caused by the bacteria Bartonella henselae and less commonly other Bartonella species. The disease spreads when an infected cat licks a person's open wound or bites or scratches a person hard enough to break a surface of the skin. About 3 to 14 days after the skin is broken, a mild infection can occur at the site of the scratch or bite. Who is at risk? Young cat that less than 1 year age, strays cat or cats living in shelters are most likely to have the bacteria. Any person can get sick from CSD, but illness is most common in children and adolescents under 15 years old age and people with weakened immune system. About 1/3 to half of cats have been exposed to the bacteria at some points in their lifetime. Although most infected cats do not appear sick, some cats may experience mild illness with fever that lasts for approximately 2 to 3 days. Rarely, the disease can cause more serious signs in cats, including vomiting, red eyes, swollen lymph nodes, tiredness, or low appetite. Bartonella infection in dogs is less common but more likely to cause illness compared to cats. The CSD may cause a mild infection with a small, raised solid bumps at the site of the scratch and lymph node swelling near the site of the scratch. This occurs 1 to 3 weeks after exposure. The infection can also cause fever and less commonly eye infection and also muscle pain. Toxoplasmosis is an infection caused by microscopic parasite called Toxoplasma gondii. Toxoplasma can cause severe illness in infants infected before birth or in persons with a weakened immune system. What is the symptoms of toxoplasmosis? Individuals with healthy immune system may feel like they have the flu with swollen limb glands or muscle ache and pains that last for several weeks or more, while individuals with weak immune system will experience severe symptoms such as seizures, poor coordination, and nausea or vomiting. So how can we protect our cats from toxoplasmosis? First, feed our cat commercial dry or canned food. Secondly, never feed cats raw meat because this can be a source of toxoplasma infection. Third one, keep indoor cats indoors so they do not become infected by eating small animals. That's all from me. I hope this will gain your knowledge, and thank you for listening to me.